Welcome everyone to what I hope is an insightful session on how official coding guidelines influence our documentation processes. Today we'll delve into why these guidelines are not just recommendations, but essential tools for maintaining the integrity and accuracy of medical documentation. As we proceed, I invite you to consider how these practices apply to your day-to-day responsibilities and the broader implications for patient care and healthcare delivery. My name is Toni Appleberg Parks, and I'm a health administrator, clinical documentation integrity or improvement specialist from the United States, and professional coder, and I am so happy to be here today and so thankful to be spending your valuable time with you. Before we move forward, please note that the contents of this presentation are protected under copyright laws and are intended for educational purposes only. This information should not be replicated or used without proper authorization. Our goal today is to enhance your understanding and practice of medical documentation through framework of official coding guidelines. Okay, let's get started by understanding what coding guidelines really are. These are not just arbitrary rules, but are carefully crafted protocols that help us translate complex medical information into standardized codes. This process is crucial for accurate health records and plays a significant role in treatment decisions, billing, and legal documentation. Think of these guidelines as the blueprint that helps bridge the gap between healthcare professionals and administrative systems. Accurate documentation is vital in healthcare, serving as the foundation for quality patient management, billing, and overall healthcare administration. It begins with a thorough understanding of coding standards such as ICD-10 and CPT. ICD-10, or the International Classification of Diseases 10th revision, is a coding system used worldwide that categorizes diseases and a wide range of health conditions. This system allows healthcare providers to code various aspects of patient care, ensuring that symptoms, diagnoses, and procedures are documented precisely. For instance, ICD-10 enables the coding of diseases from simple viral infections to complex chronic diseases like diabetes. CPT, or current procedural terminology codes, on the other hand, are used primarily in the United States to describe medical, surgical, and diagnostic services. These codes communicate uniform information about medical services and procedures to healthcare providers, payers, and accreditation organizations. Let's look at an example. Consider a patient diagnosed with diabetes mellitus. The base ICD-10 code for diabetes mellitus is E11. However, the specifics of the condition can vastly differ. E11.9 is diabetes mellitus type 2 without complications. E11.21 is diabetes mellitus type 2 with diabetic nephropathy, and E11.40 is diabetes mellitus type 2 with diabetic neuropathy, unspecified. And there are a whole slew of these codes for different complications of diabetes. Each of these codes represents a different manifestation of diabetes, impacting treatment plans, monitoring strategies, and insurance reimbursements. For example, a patient coded with E11.9 might require less frequent medical follow-ups compared to one with E11.40. So this plays out into scoring, into severity. So if it's not documented that this patient has the complications, it won't be coded as such, and overall it will affect reimbursement and data, the data that's captured. So as I was saying, A patient coded with E11.9 might require less frequent medical follow-ups compared with one with E11.40 who might need comprehensive neurological examinations and possibly more aggressive management strategies. Insurance claims processing also depends heavily on these codes. Inaccuracies can lead to claim denials and incorrect billing, affecting both the provider revenue and the patient's treatment continuity. Proper documentation and accurate use of ICD-10 and CPT codes ensures that patients receive appropriate care tailored to their specific health conditions, while also facilitating effective communication among healthcare providers. Also insurers and other stakeholders involved in healthcare management. This accuracy not only supports appropriate patient care, but also ensures that healthcare providers are reimbursed correctly and efficiently, maintaining the financial health of medical practices. Okay, and on to our next slide. Integrating coding guidelines into daily clinical practice transcends mere adherence to rules. It fundamentally enhances the quality and integrity of clinical documentation. This integration is vital for several reasons. Number one, ongoing training for healthcare staff. Continuous education is crucial for all healthcare professionals, from doctors to administrative staff. Training sessions should be regular and comprehensive, covering new updates in coding systems like ICD-10 and CPT, as well as revisions to existing codes. And this happens yearly, so training should also happen yearly. These sessions help staff understand the direct impact of accurate coding on patient care and healthcare operations. Number two, interactive workshops and seminars can be effective using real-life scenarios to illustrate how coding affects everything from patient care to billing and compliance. Online modules and quizzes can also reinforce this knowledge, ensuring that staff are tested and remain proficient in their coding skills. That wasn't number two, that was the second part of that. Number two is regular updates on coding systems. The field of medicine is continuously evolving, and so are coding standards. Regular updates are essential to ensure that coding practices stay relevant and accurate. Healthcare facilities should have protocols in place to swiftly disseminate changes in coding guidelines to all relevant staff. For instance, when the World Health Organization releases updates to the ICD-10 codes based on new medical research or diseases, such as the recent addition of codes for COVID-19, these updates must be communicated through internal newsletters, excuse me, emails, or dedicated training sessions. Routine audits are essential to verify that the codes being used accurately reflect the clinical documentation. These audits help identify common coding errors and provide feedback for improvement. Auditing can be done internally by a dedicated team or externally by consultants specializing in medical coding. The results of these audits should lead to a targeted training session or targeted training sessions to address any deficiencies uncovered, thereby refining coding practices and preventing future errors. So let's look at an example of a practical application with this. Consider the scenario where a new set of codes is introduced for advanced diabetes management, including specific complications like diabetic retinopathy or nephropathy. It's imperative that the clinical team is updated immediately to use these specific codes, which ensures precise documentation and appropriate patient management. Without quick updates and thorough training, A clinician might continue using outdated codes, leading to miscommunications with insurers and possibly affecting patient care outcomes. By maintaining a cycle of education, updates, and audits, healthcare institutions not only comply with legal and professional standards, but also enhance the overall quality of patient care. This proactive approach ensures that all team members are equipped with the necessary knowledge and skills to handle their roles effectively, thereby optimizing both clinical outcomes and operational efficiency. Okay, let's look at a case study. This case study is at City Hospital. We've looked at this hospital before, but we want to see how they improved reimbursement through accurate coding. So here's the background. City Hospital faced significant challenges with its billing processes, experiencing a high rate of claim denials and delayed reimbursements from insurance companies. This was primarily due to coding errors in the use of outdated codes in the medical billing system. So the problem was that the hospital's coding team frequently used incorrect or outdated ICD-10 and CPT codes for various medical procedures and diagnoses. For example, coding for the advanced treatment of heart failure often missed specifying the type of heart failure. Specificity, that's so important in our documentation, but also in our coding. So systolic versus diastolic, leading to incomplete documentation and subsequent claim denials. Excuse me. So what was their solution? City Hospital implemented a comprehensive coding update and training program. This included regular workshops to educate the coding staff on the latest ICD-10 and CPT code revisions. They did monthly audits to identify and rectify coding inaccuracies, and they implemented new coding software that automatically updated with the latest codes and provided real-time feedback on potential errors before finalizing claims. They implemented this over a 6-month period. The hospital conducted focused training sessions for their coding team, emphasizing the importance of specific and accurate coding. They also introduced a coding compliance officer to oversee the entire process and to ensure adherence to coding guidelines. So how did it work? What was the outcome? After implementing these measures, City Hospital saw a dramatic improvement in their billing accuracy. The rate of claim denials due to coding errors decreased by 40% within the first 3 months. Now, I don't know how big City Hospital is, but 40% could be a gigantic number. Reimbursement time from insurance companies improved with a 30% increase in on-time payments, so less kickbacks, less rejections or even denials, I would say. The hospital observed a marked improvement in compliance with healthcare regulations, reducing the risk of penalties and fines associated with misreporting. So, big outcomes. So what's the conclusion here? This case study demonstrates how precise and updated coding practices can significantly enhance reimbursement rates and ensure compliance with healthcare regulations. City Hospital not only improved its financial health, but also ensured more reliable and efficient patient care management through better coding practices. All right, as we reach the conclusion of our discussion, it's essential to emphasize that understanding and effectively applying coding guidelines is more than just a procedural necessity. It is a critical skill that significantly influences several key areas in healthcare. The first one is regulatory compliance. Precise documentation and coding are mandatory for meeting national and international health reporting standards. By adhering to these guidelines, healthcare providers ensure compliance with laws and regulations, reducing the risk of legal issues and penalties which could arise from incorrect or misleading documentation. The second one is financial stability. Accurate coding directly impacts the financial health of medical practices and hospitals. It ensures that services are billed correctly and reimbursements from insurance providers are received without delay. This financial stability is crucial for maintaining the operations of healthcare facilities, allowing them to invest in better resources, technologies, and staff training programs. Number 3 is patient care and safety. The most profound impact of effective coding practices is on patient care and safety. Detailed and accurate medical records help in creating a comprehensive understanding of a patient's medical history, ongoing treatments, and future healthcare needs. This information is critical for all healthcare providers involved in a patient's care, ensuring that treatment decisions are informed, timely, and appropriate. Furthermore, accurate coding allows for the correct interpretation of a patient's condition across different healthcare settings, which is crucial in emergency situations or when a patient is receiving care from multiple specialists. And number 4, facilitating research and public health monitoring. On a broader scale, standardized coding plays a vital role in health research and public health monitoring. It allows for the aggregation and analysis of data on various health conditions, treatment outcomes, and public health trends. The data is invaluable for medical research, shaping health policies, and implementing public health interventions aimed at improving the overall health of the population. And number 5, enhancing healthcare outcomes. Ultimately, by ensuring that our documentation mirrors the true complexity of patient care, we lay the foundation for enhanced healthcare outcomes. Detailed records that accurately reflect a patient's condition make it easier to track progress, adjust treatments, and predict outcomes, leading to higher quality care and tailored to individual needs. In embracing these guidelines, we commit to a standard of excellence in healthcare that benefits not only individual patients, but also the larger community by enhancing the effectiveness and efficiency of our healthcare systems. This commitment is pivotal in advancing our mission to provide outstanding care